I'm going out to see for myself the results of all of our efforts in Sierra Leone to help the government there combat Ebola, building the treatment beds as we're doing in Kerry Town, working communities to help treat patients earlier, the burial teams that we're helping to scale up, which are making sure that infections don't get passed on through funerals, and of course all the amazing work that we're doing on the ground with NGOs who are also there helping to combat Ebola. First of all, Ebola is killing hundreds, thousands of people in West Africa. If we don't combat it, it will take so many more lives. But it also can pose a risk to the UK. The risk so far is low to us, but as the Chief Medical Officer, Dame Sally Davison, says, we can expect a handful of cases. So it makes sense to work with governments like Sierra Leone, with West Africa as a region, to combat Ebola in the region so that it doesn't pose more of a risk to the British public. I'm on a plane today with about 100 medics from the Royal Army Medic Corps who will be out there training healthcare workers so that they can provide the healthcare levels that we need in order to bear down on Ebola. It's very difficult to catch Ebola unless you actually touch someone who's with Ebola and showing symptoms. But of course, all the precautions that are in place for anybody coming back from the affected region within West Africa are there, around screening, around making sure that we have temperature checks and then staying in touch with people after they arrive back in the UK. So I have absolutely no doubt whatsoever that all of the duty of care that we need is in place to our amazing MOD staff who are out there working with us, but also the broader government efforts, Foreign Office, DFID, to make sure that our duty of care to them is there.